So hi everyone, this is Dr. Aman. Today I have with me Dr. Mohsin Raj, who is a cardiologist and he has done his MD and DM from AIIMS New Delhi. Today we are going to discuss anything and everything about how to approach medicine as a subject, be it for a PG aspirant who has maybe less than a year or maybe just 3-4 months for his PG exam or INI-CET, or be it for a final year exam going student who has his exams in the next 2 to 3 months, or be it for a third year MBBS student who has good 1 to 2 years for comprehensive coverage for the medicine as a complete subject. So welcome Dr. Mohsin.
So thank you for this opportunity, and I hope we'll have a productive session for our students. So I think you start with this first question, which is basically the most important one right now, because the NEET-PG is over. So we will have a lot of interns. You will have also students who have appeared in NEET-PG and are trying to appear for either upcoming INI-CET or the next NEET-PG. So basically someone who has got 6 months or 3 months or 6 months or maybe more time for this preparation of 19 subjects, but now we are focused on medicine, which is probably a very, very important topic, because together it will constitute a lot of questions, be it INI-CET or medicine. So let's focus on the resources that you have to use and resources which you better avoid at this point of time.
Right.
Okay.
So one thing you have to understand, that medicine is not something you can complete in entirety. So you have to focus more on things which are asked more in the previous year questions, more in the exam. And that is what you can know by doing the PYQs and knowing the PYQ topics. Second thing is, I'll say golden rule, don't go about the rare questions or rare syndromes or rare diseases. Go for things which are common, the diseases which are common. So you have to be PYQ oriented and read PYQ topics very thoroughly. Harrison and standard books are a big no-no if you have less than a year for your PG preparation. Now, what I have done personally, I'll tell you in an unfiltered way. And by the way, this is a non-sponsored video, so I can tell in entirety. So point number 1, I went through the rapid revision videos of Dr. Deepak Marwa in entirety, and they were really good, and they had a very good focus on the PYQ related topics and covered very well a lot of things. Second thing, for endocrinology, neurology and cardiology, for these 3 topics, I had seen Dr. Thameem's LMRP videos from eGurukul Lab. So these were my 2 important resources. Apart from this, especially for INI-CET, ECG and emergencies constitute a very important topic. For this, for ECG, I have seen Dr. Mohsin ki ek playlist. There is a playlist that is amazing. In just 1 hour or 1.5 hour, you can be through with entire ECG and you will almost hit any or every question you will be hitting. And there is a 20-minute video of sir which I saw, and there were I think 2 or 3 questions in my INI-CET attempt, and I could attempt correctly all 2 or 3 of them. Now next is that emergencies, ECGs, ABGs, these are important. You have to do that. You don't have to leave that. Then if I'll summarize, what is medicine? Medicine is path, pharma, micro, along with the management and the treatment part, right? So if you have less time with you, I would suggest, and if you have a good command on path, pharma and micro, you can maybe just do the management part and the above specific medicine topics in maybe 5 to 7 days. If you've not read these basics clearly, you may give a first reading of 15 days, then the second reading of 5 to 7 days, and then summarize everything in the next 3 days. Every reading you are doing, you have to know what you are going to read in the next reading. So you have to highlight or star mark accordingly. Other thing is that no one read all medicine topics. What do you have to say about that, sir?
Absolutely. See, medicine is a big specialty. The same list of topics even a medicine resident will read. So that doesn't mean that someone who's preparing for an MCQ exam has to read all those topics. So your focus is on the topics which have appeared in the exam. See, if there's a big section, say cardiology, so there will be 7-8 chapters, including pericardial diseases, valvular diseases, heart failure, non-ST elevation MI, ST elevation MI, some pathophysiology topics, some physiology topics in that medicine book. But you will only read those topics which have appeared in the exam, and specifically the portions of that topic which have actually appeared in the exam. Say for example, if you're reading ST elevation MI, if they have asked about the door to needle time or door to balloon time, you will focus on that portion of that ST elevation MI and not the entire ST elevation MI. If they've asked a particular, say for a recent NEET-PG question was, say which beta blocker reduces mortality in heart failure. So you will focus on only the management of heart failure, and that to the drug therapy of heart failure, and there you get to know that these are the drugs that improve mortality in a patient of heart failure. So it has to be selective rather sub-selective. Select the topic, sub-select the heading which has been asked in the exam and read that thing, because that is the way you will finish medicine in 1 week. So you have to finish medicine in 5 to 7 days if you're reading it like for an exam which is just 2 months away. Okay, so you will not focus on all the topics that title just which is there in the every book. They will a list of topics. You don't have to read all of those. You have to read topics, subtopics selectively. That is the key to reading medicine. And remember, if you have read pharmacology, if you have read pathology, if you have read microbiology, that is almost done. Medicine is done. You just have to brush up the things in the management portion. And last but not the least, because exams are getting more and more clinically oriented, so it's very important while you're reading up the things, if you find any clinical sign, an image of a clinical sign being elicited. For example, in a case of neurology, they might elicit meningeal signs. So if they show you a picture, for example, of Kernick sign being elicited or any other sign being elicited, say JVP being checked, so you just keep that in mind, that it might be the next top question in INI-CET, because exam is getting clinically oriented. So those things you might want to keep in mind.
Now, let us shift our focus to the 3rd and 4th year MBBS students who have decent 1.5 year, 2 year time to prepare medicine, first for their exam, prof, and then for the PG. So first and foremost thing, now since the competition is increasing so much, so you have to be the part of the PG exam race. You cannot say just that you will just read medicine because you have a love for MBBS. That's good, but you have to stay in the race. And at the same time, do not lose your clinical understanding. Now for that, there are 3-4 things which we have listed in the order of highest priority to the lowest priority. Over to you, sir.
So that's absolutely right. See, I often promote reading standard textbooks. If you follow my videos, I've been promoting standard textbooks, read them. But understand that you're participating in an exam in which 2 lakh students appear, and you have to be in top 1,000, 2,000 to get a good branch and a good institute, right? So you don't want to miss this race. It's not a FOMO, but it's a true thing, because you have to be a part of this race. So what we have done is these 3-4 things, if you cover up, you are like a part of that race. You are at the front of that race. First thing is first. You cannot come to me and ask what is the list of important topics that I need to read, or to him what is the list of topics that I need to read, because you already have the list of patients in your wards. Go to your clinical postings in MBBS. See, attending a lecture from a faculty through his PowerPoint is obsolete nowadays. You have a better teacher from an online module. You have a better comprehensive talk in your marrow, for example. So that's not that much important. But what is important is the patient in your ward. There will be 50 patients in your medicine ward admitted at the same time. You go check their diagnosis, and wherever you find the commonest diagnosis being repeated, say heart failure patients, and out of those 50 patients being admitted, 5 of them would have heart failure. 5 of them, or 10 of them would have had a heart attack. So 5 or 10 of them would have had a stroke. So that gives you an idea which is the commonest clinical problem. Or if you go to an OPD, you'll see patients of diabetes, patients of rheumatoid arthritis, or so many things. So please attend clinical postings. You will get to know the list of important topics. You will get to know the list of common diagnoses and diseases that you have to read. What's the next thing you do? You go back home, you read those common diseases. You don't have to read whole of endocrinology, whole of cardiology, no. But you have to read the patient that you saw in the ward. You have to read that portion, heart failure, you have to read heart attack, you have to read stroke from a standard textbook. Why? Because you have 2 years, you have 1 year, you're just an MBBS student right now. Or if you cannot read a book as big as Harrison, because say you might argue that Harrison is written in a little bit more complicated fashion, it's more condensed form, it's a very dense and comprehensive information. You can at least build a framework in your mind. You can at least make that big picture in your mind that this is the topic, these are the headings, and this is the rough thing that is being discussed here. Okay, so you can make that framework in your mind. That will make your life easy in medicine. Okay, and probably
I have something to add.
Yeah.
So I'll be honest over here. I was not someone who had gone through the standard textbooks a lot in my MBBS curriculum, but one thing I was thorough was with the medicine posting in my final year, and I attended almost every class, every round, everything in that. and that gave me, I think, a basis in medicine about what to read, what is important. And the second thing which I did was that for my final MBBS exams, I didn't read Harrison, but the tables of mini Harrison, that is something which I went through, and that is something which I will say is the cream of Harrison.
Exactly. That will be a shortcut. That could be a shortcut. That could be that framework I'm talking about. Yes, you can read that mini Harrison, get those tables, those pictures in your mind, get that framework in your mind. And third, emergencies. Emergencies are important for two reasons. One, they'll be asked in your prof exams, even written exams, theory exams, as well as the practicals. And second, they form a very favorite topic of INI-CET. Okay, so these are the two reasons why you need to read emergencies. And how do you do that? One option is to read it from the textbook. Right? You can read, say, Management of Acute Severe Asthma from Harrison, for example, or any other textbook. The second option would be, again, to go to your postings, go to emergencies, and actually see live when a patient of heart attack comes, what is the first drug that they give. When a patient of acute severe asthma comes, what is the first therapy they give, what is the first investigation they do. When a patient of pulmonary embolism comes, what is the drug they give. So that will come either when you visit an emergency or if you read from a textbook. So focus on emergencies. This is important for your profs. This is important for your INI-CET. Now, what about the rest of the material, right? So medicine is a big book. It's a big fat book. And you have read just the common disease. You have read about the patients that you see in the ward. So you have read about emergencies. Now, what about rest of the topics? See, I understand time is very short. No matter what, even like for an MD medicine resident, he gets 3 years to read and still he will not be able to cover entire Harrison. Okay, so I suggest you have to keep your eye on previous year topics. So again, this is important. Your preparation has to be streamlined by previous year questions and previous year topics. So read those areas from your coaching material. Could be any form, Marrow, Prep Ladder, doesn't matter. It's not any sponsored video. So for those full medicine videos, you at least focus on the areas that have been asked in the exam, because once you enter internship, if you're in third or fourth year, and if you have made notes at this point of time, if you have made notes of emergencies, if you have made notes of common disease, if you have made notes of previous year topics, that means you can revise them in a matter of 5 or 6 days or 1 week in your internship. You can read those topics 5 times, 10 times, and that means you will master those questions. You'll get almost all of the questions right. And about rare diseases that he talked about initially, those questions come in every exam, and those questions are unlikely to repeat.
If there's don't decide the topper, exactly, I would say.
Exactly.
Right.
So yeah, in for example, the NEET-PG exam, some people say it was a very difficult exam. Okay, but those 40 difficult questions won't decide the top rankers. If you get 160 those average questions correct, don't commit silly mistakes, because those will come from this bulk of the topics that we are talking about.
And toppers don't commit those many silly mistakes.
Exactly.
They don't make an easy question wrong. That is what you have to understand.
So when you go back home from the exam hall, you shouldn't be like, oh, I shouldn't have gone this question wrong. This shouldn't have happened. So that is the thing I want you to remember. And revise and don't commit silly mistakes.
And apart from that, let's say if you have maybe just 3 or 4 months remaining for your final year exam, and now you are thinking about what to do. First thing is that go through the mini Harrison ki table, and second thing is see your previous year questions in your medical college, and ask your seniors and mark exactly. Your books.
This is true. See, I'm from a government medical college, GMC Srinagar. He has done his MBBS from AIIMS, but the methodology is the same. I got my book marked from seniors. He must have got his book marked from seniors. He must have seen the previous year papers. I have seen the same previous year papers. We've read those topics from any resource. Let me tell you, in a theory exam, if you know the framework that I'm talking about, if you know the title, the subtitle, rest you can fill in the things. It would be like fill in the blanks, and that way exams would be easy. You have to get the big picture in the mind that this is what I have to write. You don't focus on the details on those types of exams. And for practicals, I still believe that reading those books like Hutchinson's, or now Hutchinson's gone little it's too much theoretical now. So reading for your practicals, reading the books of clinical examination is very useful, and those types of questions are likely to appear in NEET-PG exams or INI-CET exams in the coming years, because exams are getting more clinically oriented. Okay, so that should finish your MBBS portion of medicine.
Yes, and apart from the last thing, if you're some of those who are not making notes, that's completely fine. If you're reading through a printed resource printed notes, that's also fine. But you have to make that thing revisable, and that you do by highlighting, star marking, or any way you have, so that you are able to revise that in your internship for your PG preparation. That is important. So at the end, you need to have a revisable resource for your exam preparation.
Exactly.
Second thing is, don't have a FOMO that you were not able to complete the entire Harrison or complete medicine, because even after doing MD medicine, or sir, even after doing maybe sir has done DM cardiology, you'll always have a lot to learn more.
Exactly. So, see, if your final target is getting a good rank in NEET-PG, it doesn't matter what you've done in MBBS. You have those internship year, 12 months, or you have 6 months, say, for the exam. If you prepare well, nobody can stop you from getting a good rank. So your preparation has to be streamlined and has to be focused on previous year topics. You will do good. Finally, it's an MCQ exam. You have a question, you have 4 answers, one of them is correct. If you have slight common sense and something that you have read and revised, you'll get it invariably correct. Yeah.
That's all from my side. Thank you so much, Dr. Mohsin, for sparing your valuable time and coming. And thank you so much, everyone, for watching this. If you want another video with Dr. Mohsin and me, comment down the topic name, and please like and subscribe this channel so that we can keep making such videos for you more. Thank you so much for watching.
Thank you.
Bye-bye.